Have you ever been sitting comfortably in your favorite chair, completely relaxed, when suddenly your heart started racing out of nowhere? Or maybe you stood up a little too quickly and the whole room seemed to spin longer than it should. Moments like these may feel harmless, but sometimes they're your heart's way of sending out a quiet cry for help. Heart failure doesn't always burst onto the scene with a dramatic heart attack or an emergency rush to the hospital. In reality, it often begins silently with small signals that are easy to dismiss. That's exactly what we're going to explore in this video. Those early hidden clues your body uses to warn you before things get serious. No complicated medical terms, no overwhelming statistics. Just a simple, honest conversation between you and me about what your body might be whispering. Because when it comes to your heart, the little things matter. Ignoring them could lead to major consequences down the road. If you're ready to really listen to what your heart is trying to say, drop a yes in the comments. And of course, don't forget to subscribe to Total Elderly Wisdom Diaries so you never miss out on helpful tips like this. Now let's uncover the very first sign that often slips right under the radar. When your heart gets tired, it doesn't always scream in pain. Sometimes it just works overtime, beating faster, as if trying to make up for lost strength. That's why a rapid resting heartbeat can be one of the earliest red flags of heart failure. Normally, while you're sitting still, your heart should beat steadily, somewhere between 60 and 100 beats per minute. But when your heart weakens, it has to push harder to circulate blood through your body, even when you're doing absolutely nothing. That's when you might notice your chest pounding, fluttering, or racing without warning. Some people describe it as a sudden thump-thump that catches them off guard, even when they're just watching TV or flipping through a book. And this isn't something that comes and goes without impact. Over time, that constant extra effort drains your heart even more. Experts at the American Heart Association warn that having a consistently high resting heart rate is strongly linked to earlier heart failure and a greater risk of complications. So if this feels familiar, don't brush it off. Start by keeping a simple log of your heart rate, especially when you're not active. Whether it's a small notebook or a phone app, that habit could be the very first step in protecting your heart for the long run. These days, you don't need fancy medical gear to check your heart rate. A simple wrist monitor will do the job, and most smartphones now have built-in features to track it too. If you notice your resting heart rate consistently climbing above 100 beats per minute, don't ignore it, bring it up with your doctor. Such a small step could prevent bigger problems down the line. Now let's move on to another early signal, one that many people often mistake for simply getting older or just being overly tired. Have you ever walked into a room only to forget why you went there in the first place? Or maybe you've had trouble following along in a conversation or found your attention slipping away while reading the newspaper. Sure, it's easy to brush this off as normal aging, but sometimes it's your heart trying to get your attention through your brain. Here's why: when the heart doesn't pump efficiently, less oxygen-rich blood makes its way to the brain. And your brain thrives on a constant supply of oxygen to stay sharp. Without it, you may find yourself feeling foggy, forgetful, or losing your train of thought more often than usual. This isn't just absent-mindedness, it can be a warning sign. Research published in the Journal of the American College of Cardiology shows that even in the earliest stages, heart failure is often linked to cognitive decline. Everyday slip-ups like misplacing your keys, zoning out in mid-conversation, or feeling mentally off can be more than bad habits. They may reflect reduced blood flow to the brain. If any of this feels familiar, start paying attention to when it happens. Do these lapses show up after climbing stairs during physical activity, or later in the evening when you're worn out? Keeping track of these patterns can give your doctor valuable clues and help connect the dots. This isn't meant to scare you. It's about catching problems early while you still have plenty of options to protect both your memory and your heart. Now let's turn to another sign that's easy to miss, but often shows up in your legs by the end of the day. Have you ever noticed that come evening, your socks leave deep marks around your ankles? Or your shoes suddenly feel tighter, even though they fit perfectly in the morning? That swelling in your feet, ankles, or lower legs could be another early sign your heart is under stress. When your heart can't pump efficiently, blood begins to pool in the veins, pushing fluid into surrounding tissues. That's why the swelling usually shows up in both legs and tends to worsen as the day goes on. It's not just about tired or overworked feet, it's your body signaling circulation issues. Doctors call this condition peripheral edema, and it's one of the most common red flags of heart failure. According to the National Heart, Lung, and Blood Institute, this fluid buildup in the lower body is often a clear warning that your heart is struggling to keep up. The good news, there are simple ways to check for it right at home, something we'll get into next. Here's a quick test you can try at home. Press your thumb firmly against your shin. If a dent remains after you let go, it's worth mentioning to your doctor. New or worsening swelling, especially when paired with sudden weight gain or shortness of breath, should never be brushed aside. Your legs may actually be telling the hidden story of what's going on inside your chest. By paying attention early, you can reduce the strain on your heart before it gets worse. Now let's move to another warning sign, one that can leave you dizzy, lightheaded, or even on the verge of fainting. Have you ever stood up from a chair and suddenly felt like the whole world tilted for a few seconds? Or maybe you've had moments where you nearly blacked out while doing something simple like walking across the room. Many people think these dizzy spells are just a part of aging, but in reality, they can be your body's way of showing that your heart isn't pumping enough blood to your brain. When circulation weakens, even small movements like rising from your seat or taking a few steps can trigger a sudden drop in blood flow. That's why people in the early stages of heart failure often describe feeling lightheaded, faint, or dangerously close to passing out. In fact, research published in the European Heart Journal has confirmed a strong link between reduced blood supply to the brain and these symptoms. The concern isn't only the discomfort, it's the danger. For older adults, fainting or losing balance dramatically increases the risk of serious falls and injuries. If this happens to you more than once, don't dismiss it. Write down the details when it happened, what you were doing, and how long it lasted. Did it come after standing up too quickly? After mild exercise, these details can give your doctor important clues. And here's a tip: the next time you feel dizzy, sit down right away, take slow, steady breaths, and give your body time to recover. Most importantly, don't forget to bring it up with your doctor. Recognizing these signals early can protect both your heart and your safety. Now, let's talk about another sign, one that often keeps people awake at night. Do you find yourself waking up several times just to use the bathroom? It may feel like nothing more than an annoying part of aging, but frequent nighttime urination, what doctors call nocturia, can actually be an early warning sign of heart problems. Here's why: when you lie down, the extra fluid that built up in your legs throughout the day shifts back into your bloodstream. As a result, your kidneys start filtering more, which triggers repeated bathroom trips during the night. Over time, this pattern can reveal that your heart is under more stress than it should be. Waking up 3 or 4 times every night to run to the bathroom isn't just about poor sleep. It's often a reflection of fluid overload, which can be an early sign of heart failure. According to experts at the Cleveland Clinic, this symptom can actually appear before many of the more obvious red flags. And it's not just inconvenient. Interrupted sleep robs you of energy, weakens your immune system, and places even more strain on an already stressed heart. If this happens to you, frequently start keeping track. Note how many times you wake up each night and whether your legs or ankles tend to swell by the evening. Even simple adjustments like elevating your feet during the day can sometimes reduce fluid buildup. But if the problem doesn't go away, don't chalk it up to a small bladder. Bring it to your doctor's attention. Your nights are meant for deep restorative rest, not constant interruptions. By paying attention to this sign, you could be giving your heart the break it desperately needs. Now let's move on to another subtle warning signal: unusually cold hands and feet, even when the weather is warm. Have you ever noticed your fingers or toes staying cold while everyone else around you feels comfortable? Many people dismiss this as poor circulation from aging, or simply the temperature in the room, but it can actually be a sign that your heart is working harder than it should. Here's why: when the heart weakens, the body goes into survival mode. It prioritizes blood flow to the most critical areas, the brain, heart, and other vital organs, leaving less circulation for your arms, legs, and skin. That's why some people with early heart failure describe their hands and feet as constantly chilly, sometimes even numb. You may also notice that the pulse in your wrist or ankle feels faint because less blood is reaching those areas. Research published in the American Journal of Cardiology found that reduced blood flow to the outer parts of the body is actually quite common in people with early heart dysfunction. It's the body's way of protecting the essentials, but it leaves your extremities out in the cold. If you notice this happening often, pay attention to how your hands and feet compare to others around you. Are you always the one shivering or rubbing your palms together? while everyone else feels fine? That contrast can be an important clue worth mentioning to your doctor. Cold hands and feet might seem like a minor nuisance, but they can be the quiet whispers of a much bigger problem inside. And now let's talk about another signal, one that often reveals itself when you try to be active, feeling short of breath even with the lightest effort. Do you find yourself getting winded just from climbing a short flight of stairs or walking out to the mailbox? That kind of breathlessness with light activity is one of the most common early signs of heart failure. When the heart can't pump strongly enough, blood begins to back up into the lungs. This makes it harder for oxygen to move where it needs to go, and that's why even small everyday tasks can leave you feeling as if you've just run a marathon. And here's the important part. This isn't about being out of shape. Research published in the Journal of the American Medical Association shows that shortness of breath during mild activity can appear years before someone is formally diagnosed with heart failure. Unfortunately, many people dismiss it, assuming they're just getting older or slowing down. But really, it's your body sounding the alarm. If this feels familiar, start paying attention to the details. Do you notice it while carrying groceries, tending to the garden, or even trying to hold a conversation while walking? Tracking when and how it happens can help your doctor see the bigger picture. A helpful step in the meantime is pacing yourself. Take breaks. Move more slowly and don't force your body to push through overwhelming fatigue. But above all, don't ignore it. What seems like a minor inconvenience today could be your heart's way of asking for help. Now let's talk about another warning sign that often shows up when you're trying to sleep: the struggle to breathe comfortably while lying down flat. Have you ever tried to rest in bed only to feel as though you couldn't catch your breath? Many people with early heart failure notice they need extra pillows under their head or back just to breathe with ease. Some even resort to sleeping upright in a chair because it's the only way they can drift off without that heavy, suffocating feeling. This isn't about simple snoring, aging, or being restless. It's actually a condition called orthopnea. Here's what's happening when you lie flat: the extra fluid in your body shifts upward, placing additional pressure on your lungs. A weakened heart can't handle that added load, and the result is a sensation of tightness, breathlessness, or even panic. Studies in the New England Journal of Medicine show that orthopnea is one of the strongest early predictors of heart failure progression. In fact, it often shows up before many of the classic symptoms people expect. You can test this for yourself by noticing how many pillows you regularly use to sleep. If you consistently need 2 or 3, or find that you can only rest comfortably in a reclined or upright position, that's a signal your doctor needs to know about. Here's another warning sign that often sneaks up without much notice: sudden weight gain that has nothing to do with what you've been eating. Have you ever stepped on the scale and realized you've gained 2 or 3 pounds overnight, even though your meals and routines haven't changed? That kind of rapid increase is rarely about food. More often, it's your body holding on to fluid, a classic early signal of heart failure. When the heart isn't pumping effectively, the kidneys react by holding on to extra salt and water. That fluid begins to collect, not only driving the numbers on the scale upward, but also causing swelling in your ankles, stomach, or even making it harder to breathe. The American Heart Association points out that a sudden jump of more than 2 to 3 pounds in a single day, or 5 pounds in a week, is a serious red flag that your heart needs attention. That's why many doctors recommend weighing yourself at the same time every morning. It's one of the simplest ways to spot changes before they turn dangerous. If you notice your weight spiking, suddenly don't brush it off, call your healthcare provider. Keeping a small daily weight log, whether in a notebook or on your phone, can make a real difference. A few pounds may sound insignificant, but when it comes to your heart, those extra pounds can be your body's way of shouting for help. Now let's talk about another signal, this time coming from your stomach, feeling full bloated or even losing your appetite. Have you noticed you feel stuffed after just a few bites? Or maybe you're dealing with bloating that doesn't really match what you've eaten. That uncomfortable heaviness in your belly can also be an early clue that your heart is struggling. Here's what's happening: when the heart weakens, fluid can start to accumulate in the abdomen, a condition known as ascites. This extra fluid puts pressure on the stomach and liver, leaving you with a sensation of being full even when you've hardly eaten. Many people mistake this for indigestion, a sluggish digestive system, or just eating too quickly. But in reality, it can be another sign that the heart is having trouble keeping blood flowing smoothly. The National Heart, Lung, and Blood Institute highlights that abdominal swelling, loss of appetite, are very common in people with early heart failure. If you've noticed your waistband feeling tighter by the evening, or if you've started losing interest in meals you once looked forward to, it's worth paying attention. Keeping a simple food and symptom diary can give your doctor valuable insight into what's happening and how often it occurs. And remember, this isn't just about comfort. If your body isn't taking in enough nutrition, it weakens even further, leaving you more vulnerable. Protecting your appetite means protecting your strength. Now let's move on to another often overlooked warning sign, a nagging cough or wheeze, especially noticeable when you're lying down at night. Have you ever gone to bed only to be kept awake by a dry cough that just wouldn't stop? For many people in the early stages of heart failure, this cough doesn't produce mucus, doesn't respond to cold medicine, and often gets worse when lying flat. Some even describe it as a faint wheezing sound, almost like asthma, but the difference is inhalers usually don't provide relief. What's really happening is that fluid begins backing up into the lungs when the heart can't pump strongly enough. This extra fluid irritates the airways, making it harder to breathe and more difficult to sleep peacefully. According to research in the American Journal of Respiratory and Critical Care Medicine, this type of nighttime cough is a common red flag of fluid overload linked directly to heart problems. If you have noticed coughing that doesn't go away with standard cold or allergy treatments, start tracking it. Does it get worse when you lie flat? Do you find you sleep better when propped up with pillows? These little details can help your doctor connect the dots. In the meantime, sleeping with your head slightly elevated may provide temporary relief, but keep in mind that only addresses the symptom. The real solution lies in having your heart properly evaluated. And now let's look at another unusual but very telling sign, struggling to breathe when you simply bend forward, like when tying your shoes. Have you ever bent down to pick something up only to feel out of breath within seconds? This surprising symptom even has a name, bendapnea. This next sign isn't about being out of shape. It's a direct signal that your heart is struggling with pressure. Changes when you lean forward. When you bend, blood naturally shifts toward your chest. For a healthy heart, this isn't a problem. But with heart failure, the added pressure makes it harder for blood to move through the lungs, leading to sudden shortness of breath. A study published in the Journal of the American College of Cardiology found that many patients with heart failure experience symptoms of bendapnea, that breathlessness while bending within just 30 seconds of leaning forward. If you notice this happening while tying your shoes, gardening, or reaching into a low cabinet, don't dismiss it. Pay attention to how quickly it comes on and how long it takes to ease once you sit back upright. What may seem like a small inconvenience is actually a powerful early clue that your heart is under stress. Now let's turn to one of the most common and most draining warning signs, persistent fatigue. Do you feel worn out all the time, even after what should have been a full night's sleep? Many people with early heart failure describe a deep, lingering exhaustion that simply doesn't go away with rest. This isn't just getting older. It's your body's way of signaling that the heart isn't pumping enough oxygen-rich blood to fully supply your muscles and organs. That constant lack of energy makes everyday tasks like folding laundry, carrying groceries, or even taking a shower feel like uphill battles. Research published in Circulation confirms that reduced exercise tolerance and chronic fatigue are among the earliest and most disabling symptoms of heart failure. Unlike normal tiredness, this exhaustion lingers and often sneaks up slowly. You might notice you can't walk as far as you used to, or that you need to pause more often during the day. If this sounds familiar, don't brush it aside. Track when you feel the most drained and what activities trigger it. Sharing these notes with your doctor can reveal patterns that make diagnosis and treatment easier. Your strength and energy are vital for your independence, and noticing these changes early could make all the difference. So as we've seen, heart failure doesn't always begin with dramatic emergencies. Instead, it often whispers its warnings: a racing pulse, swollen ankles, restless nights, nagging coughs, or simply feeling more exhausted than you should. These signals may seem minor, but they're your body's way of asking for help. The good news: catching them early can change the outcome. With proper care, lifestyle changes, and support, many people continue to live full, independent, and meaningful lives. Your heart has carried you through every step of your journey, and it deserves the same care and attention in return. If this video resonated with you, share it with a friend or loved one. Let's spread awareness and protect more hearts together. And don't forget to subscribe to Elderly Wisdom Diaries, where we bring you simple, heartfelt guidance for a healthier life.